Welcome back to Medic Talk, everybody. Ready for another deep dive? Today we're tackling a condition that affects a ton of people, arthritis.
You always hear about it, but it's pretty crazy. Over a third of Americans experience it at some point.
Yeah, that's a huge number. So it's pretty much guaranteed you'll encounter patients dealing with arthritis in your healthcare careers.
Absolutely. And that's why we're focusing on the two most common types today, osteoarthritis and rheumatoid arthritis.
Think of this deep dive as your crash course on arthritis, so you can understand the different types, spot the symptoms, and get a handle on how it's typically managed.
Exactly. We'll arm you with all the knowledge nuggets you need, whether it's to impress your professors or even handle those tough clinical rotations.
So let's jump right in. We'll start with osteoarthritis, which is often called the wear and tear kind.
Yeah, and it's super common. Like half of all adults experience it at some point.
Wow, half.
It's wild, right? Think of it this way. Imagine the cartilage in your joints is like the soles of your favorite shoes.
Okay, I can see where you're going with this.
Over time, they wear down, especially if you wear them a lot. That's essentially what happens in osteoarthritis. The cartilage that cushions your joints starts to wear away.
So it's kind of like when your favorite shoes start to feel stiff and uncomfortable.
Exactly. And just like your shoes, some joints tend to wear out more than others, like the ones that get the most use, right?
Makes sense. So we're talking like hands, wrists, knees.
Yep. All those, plus hips, feet, even your lower back.
Okay, got it. So osteoarthritis is all about that wear and tear. Now, what about rheumatoid arthritis? That's a bit different, right?
Totally different ballgame. In rheumatoid arthritis, your body's own immune system decides to attack your joints.
Whoa, so it's like your body is fighting against itself.
Sadly, yeah. And it causes inflammation and damage to those joints.
That sounds rough. And this one's less common than osteoarthritis, right?
It is, but it's still pretty prevalent, usually popping up between the ages of 30 and 60.
Okay, so that's a pretty big age range.
Right, and what's interesting is that RA, that's what we call rheumatoid arthritis for short, can actually affect other organs too, not just the joints.
Oh, so it's not localized like osteoarthritis.
Exactly. It's systemic, which makes it a bit trickier to manage.
Okay, I'm starting to see the difference. But how can you tell the two apart, symptom-wise? I mean, they both seem to cause pain and discomfort.
True. There are some overlapping symptoms, like you'll probably see joint pain, stiffness, and limited range of motion in both.
So pain and trouble moving are like the common denominators. What else should we be looking out for?
Well, the specifics and where they show up depends on the type of arthritis and which joints are affected. But you might also see swelling around the joints, changes in skin color, and even warmth to the touch in that area.
So we've got pain, stiffness, trouble moving, and some visual cues. Anything else?
One thing to remember is that arthritis symptoms can come and go.
Really?
Yeah, we call them flares, and they can be pretty unpredictable.
So one day you're fine, and the next, bam, pain and stiffness.
Exactly. And managing those flares is a big part of treatment. All right, let's shift gears a bit and talk about risk factors.
This is super important, right? Especially for aspiring healthcare pros, because you need to be able to spot who might be more likely to develop arthritis.
For sure. And from a preventative standpoint, understanding these risk factors can empower patients to make healthier choices.
Like having a cheat sheet to avoid those achy joints down the line.
Exactly. Now we've got two main types of risk factors, modifiable and non-modifiable.
Okay, let's break it down for our listeners. What can we control? Those modifiable ones.
The big one's smoking.
Ah, the classic.
You've probably heard it a million times, but it's true. Smoking raises your risk for a ton of health issues, and arthritis is one of them.
So ditch the cigarettes, people. Seriously, it's not worth it. What else?
Your activity level, it might seem counterintuitive, but being inactive actually makes you more likely to get arthritis.
Wait, really?
Yeah.
So even like moderate exercise can make a difference.
Big time. Regular movement helps keep those joints lubricated and your muscles strong, both of which protect against wear and tear.
All right, good to know. Smoking bad, exercise good, got it. What about the things we can't change? Those non-modifiable factors?
Well, age is a biggie. As we get older, our joints just naturally go through more wear and tear. It's like a car with a ton of miles on it. Things start to creak a little more.
Makes sense. What else?
Your sex assigned at birth also plays a role. Women are statistically more likely to develop certain types of arthritis.
That's interesting. I wonder why that is.
There are a bunch of theories out there, some involving hormones and differences in anatomy. But the exact reasons are still being studied. Another one is family history.
So if arthritis runs in your family, are you, like, destined to get it?
Not necessarily. Genes definitely play a role, but remember, those lifestyle choices can still make a huge difference.
That's good to hear. So it's not all about genetics. Are there any other groups that we should be aware of who might be at higher risk?
Think about people whose jobs or activities put a lot of stress on their joints, like athletes, especially if they're in contact sports, and people with physically demanding jobs.
Okay, so construction workers, nurses, anyone on their feet a lot.
Exactly. Those repetitive motions and heavy lifting take a toll over time.
Got it. So we've covered the types of arthritis, some key symptoms, and the risk factors. Now let's say someone's experiencing joint pain and stiffness. What should they expect when they go to the doctor to get diagnosed?
Well, the first thing is a good old-fashioned physical exam. The doctor will check out their joints, how well they move, and ask about their symptoms. When did it start, what makes it better or worse, that kind of thing.
So it's all about observation, feeling those joints, and asking the right questions to get a good history.
Exactly. But to really see what's going on, doctors often use imaging tests.
Like x-rays, MRIs, all those.
Yep, those are the ones. Those imaging tests help doctors get a clear picture of the joints, looking for damage that might not be visible from the outside. Things like cartilage breakdown, bone spurs, and other signs of arthritis.
So it's like getting a sneak peek inside to see what's really happening.
Perfect analogy. And sometimes blood tests are part of the picture too.
Why would you need a blood test for arthritis?
Well, they can be super helpful for figuring out what type of arthritis it is. Like, if the doctor thinks it might be gout, a blood test can check uric acid levels. Or they can look for signs of infection or specific antibodies that are linked to autoimmune diseases, like rheumatoid arthritis.
So it's about piecing together clues from different sources to get an accurate diagnosis.
Exactly. And once the diagnosis is confirmed, the focus shifts to managing it and finding the right treatment.
Because there isn't really a cure for most types of arthritis, right?
That's true. There's no magic cure. But the good news is there's a lot we can do to manage those symptoms, slow down how fast it progresses, and really improve someone's quality of life.
So let's talk about those treatment options. What are some of the common ways to manage arthritis pain and stiffness?
Well, for mild to moderate pain, over-the-counter pain relievers are usually the first line of defense. We're talking about NSAIDs like ibuprofen or naproxen, and acetaminophen, which is Tylenol.
The good old-fashioned pain meds you can get at any drugstore.
Exactly. And for a lot of people, those provide enough relief. But if it's more persistent or severe, doctors might prescribe corticosteroids.
But those are stronger, right? And you can take them orally or even get them injected directly into the joint.
Spot on. Those cortisone shots, as they're often called, deliver targeted pain relief and reduce inflammation right at the source. And for some types of arthritis, like rheumatoid and psoriatic arthritis, there's another group of medications called DMARDs.
DMARDs. Those are the disease-modifying anti-rheumatic drugs, right? They always sounded kind of intense to me. Can you break them down a bit?
Of course. DMARDs work by calming down the immune system's attack on the joints. They're specifically for those autoimmune types of arthritis we talked about. And there are actually several different kinds of DMARDs, each with its own way of working and potential side effects.
So it's not a one-size-fits-all situation.
Nope. The doctor will choose the DMARD based on the specific type of arthritis and the patient's individual needs. Now, on top of medications, physical therapy and occupational therapy are super important for managing arthritis.
So what do they do exactly?
Physical therapy focuses on improving strength, flexibility, and range of motion. Occupational therapy, on the other hand, helps people adapt to any limitations they might have and find ways to do everyday activities with less pain.
It's like learning new strategies and tricks to make life easier.
Exactly. And don't underestimate how powerful these therapies can be. They can really make a big difference in someone's life.
So it's a more holistic approach, considering both the physical and practical sides of living with arthritis.
Precisely. Now, we've talked about medications and therapies, but what about surgery? Is that ever on the table for arthritis?
Yeah, is that like a last resort kind of thing?
It usually is. We typically reserve it for when other treatments haven't been successful. You wouldn't jump into a major procedure unless it was absolutely necessary. There are two main types of surgery: joint fusion, where the bones are fused together, and joint replacement, where the damaged joint is swapped out for an artificial one.
Those sound like pretty big surgeries. What kind of outcomes can people expect after those?
They can be life-changing for some people, significantly reducing pain and getting them moving again. But, like any surgery, there are risks and a recovery period involved. It's important to have a thorough conversation with the surgeon, weigh the potential benefits and risks before deciding.
Absolutely. So moving on, what about preventing arthritis in the first place?
Ah, prevention. You know what they say? An ounce of prevention is worth a pound of cure.
Right. So what can people do to lower their risk?
A lot of it comes back to those modifiable risk factors we talked about earlier. First things first, quit smoking if you haven't already.
Check. No smoking. What else?
Maintaining a healthy weight is huge. Extra weight puts more stress on your joints, increasing your risk of wear and tear.
So watch what you eat and get moving. Easier said than done, but worth it for healthy joints.
Absolutely. And when you're exercising, choose activities that are kind to your joints. Low-impact exercises like swimming, cycling, walking, or even yoga are all good choices.
So you don't have to be a marathon runner, but just make sure you're moving regularly in a way that protects your joints.
You got it. And another important tip, if you do anything that could put your joints at risk, always wear the right protective gear.
Things like helmets, knee pads, and wrist guards. Right?
Exactly. It's all about being proactive and protecting your joints.
Okay, I'm getting the message loud and clear. Protect those joints.
Mm-hmm.
So even though some types of arthritis might be unavoidable because of things like genetics or age, there's still a lot we can do to lower our risk.
You got it. Prevention is key, and it's never too early to start making healthy choices. It all comes down to taking those small steps now that'll pay off big time later.
So true. Okay, so we've talked a lot about osteoarthritis and rheumatoid arthritis, but I know there are a bunch of other types out there. What are some of those, the less common ones that healthcare professionals might still run into?
You're right. There's a whole spectrum of arthritis conditions out there. One you might come across is psoriatic arthritis.
Psoriatic arthritis. Isn't psoriasis a skin thing?
Yep. Psoriasis is an autoimmune disease that causes those red, scaly patches on the skin. And psoriatic arthritis is an inflammatory arthritis that can develop in people who have psoriasis.
Oh, wow. So it's like a double whammy. You're dealing with a skin condition and joint pain.
Unfortunately, yes. It can be pretty tough on patients. And like rheumatoid arthritis, it's systemic, meaning it can affect other parts of the body too, not just the joints.
That's a lot to deal with. I bet treatment for psoriatic arthritis is pretty complex.
It can be. Treatment often involves a combination of medications to manage both the skin condition and the joint inflammation. DMARDs, the ones we talked about earlier, are often used to target that immune system overactivity.
Right, DARNs for those autoimmune types of arthritis. What else is out there for treating psoriatic arthritis?
One exciting area is biologics. Those are genetically engineered proteins that go after specific molecules involved in the inflammatory process.
So they're like super precise, going right to the root of the inflammation.
Perfect way to put it. Biologics have shown a lot of promise in treating both the skin and joint symptoms of psoriatic arthritis. But they do have potential side effects, and they're typically pricier than the traditional DMARDs.
So it's a balancing act, weighing the risks and benefits for each patient to find the best approach.
Exactly. Now, another type of arthritis worth mentioning is gout.
Ah, gout.
Yeah.
That's the one that's linked to like rich foods and too much alcohol, right?
There's definitely some truth to that. Gout is caused by a buildup of uric acid in the blood. And that uric acid forms these sharp crystals in the joints, often in the big toe.
Ouch, that sounds incredibly painful.
It is. Gout attacks are known for their sudden, intense pain, swelling, and redness.
So what causes that uric acid buildup in the first place?
It's usually a mix of things. Some people are just genetically prone to producing too much uric acid, while others have trouble getting rid of it properly through their kidneys. And you're right, certain foods and drinks, especially those high in purines, can trigger those gout attacks.
Okay, so things like red meat, shellfish, sugary drinks, those are the usual culprits.
You got it. And alcohol can make it harder for your body to get rid of that uric acid, too.
So managing gout often involves like lifestyle changes?
Absolutely. Avoiding those trigger foods and drinks is key, and maintaining a healthy weight can help, too. But medication is often necessary to control those uric acid levels and prevent future attacks.
Got it. So we've talked about psoriatic arthritis and gout. Are there any other, interesting types of arthritis we should be thinking about?
One more to keep in mind, especially when you're dealing with kids, is juvenile idiopathic arthritis.
Juvenile, so that means it affects children.
Exactly. It's actually the most common type of arthritis in kids, and it can cause a whole range of symptoms, including joint pain, stiffness, swelling, and even fever and rash.
That sounds really hard for young children to deal with. What causes it?
Well, idiopathic means we don't know the exact cause, but it's thought to be an autoimmune disorder, so the body's immune system is basically attacking its own tissues, including the joints.
So similar to rheumatoid arthritis in that way.
Yep, definitely some similarities there. And just like other autoimmune conditions, treatment often focuses on suppressing the immune system and reducing inflammation, usually with
I
medication.
imagine early intervention is super important in those cases.
Absolutely. Catching it early and starting treatment can help prevent long-term joint damage and improve the quality of life for these kids.
It's amazing how much there is to learn about arthritis. We've only scratched the surface here, but it's clear that it's a really complex condition.
You're telling me. And as future healthcare providers, it's so important to stay curious and keep learning about the different types of arthritis, what causes them, how to treat them, and the impact they have on people's lives.
Now, before we move on, can we circle back to DMARDs for a minute?
Ah,
I know there are different types, and I think it would be helpful for our listeners to get a better understanding of those.
you're right. That's a great point. DMARDs are a major part of treatment for a lot of inflammatory arthritis types, so it's definitely important to understand the different options.
Okay, so let's start with those traditional DMARDs, the ones that have been around for a while. What are some examples?
One of the most well-known is methotrexate. It's often the first-line treatment for rheumatoid arthritis and other autoimmune types.
I've heard of methotrexate. Isn't that also used in chemotherapy?
Yep, you're right. It's used in much lower doses for arthritis, and it basically works by suppressing that overactive immune response.
Okay, that makes sense. Any other traditional DMARDs we should know about?
There's sulfasalazine, hydroxychloroquine, and leflunomide, just to name a few. They all work a bit differently to reduce inflammation and slow down joint damage, but they generally take a while to really kick in. We're talking several weeks or even months.
So patience is key when starting those. Now, what about those newer DMARDs, the biologics we talked about earlier? Those seem to be getting more and more popular.
They are. Biologics have been a real game changer for a lot of people with moderate to severe inflammatory arthritis. They work by targeting specific molecules that are involved in that whole inflammatory cascade. Think TNF-alpha, IL-1, or IL-6.
TNF-alpha, IL-1, IL-6. Those sound pretty technical. Can you break those down a bit?
Sure, think of them like messengers in the immune system that are telling everything to get inflamed. Biologics are designed to intercept those messages, blocking them and calming down that inflammatory response.
So it's like cutting the communication lines between those inflammatory cells.
You got it. And because biologics are so targeted, they can be really effective at getting that disease activity under control and preventing damage to those joints.
But I imagine there are downsides to consider too.
There are. Biologics are usually given by injection or infusion, which isn't ideal for everyone, and they do come with a higher risk of infections and other side effects compared to the traditional DMARDs.
Okay, so there are definitely trade-offs, but it sounds like they offer a powerful option for people who don't respond to the traditional DMARDs or have a more aggressive form of the disease.
Exactly. And the field is constantly evolving, so there are always new medications and ways of giving them being developed.
That's encouraging. Gives people hope. Okay, I know we've been focusing a lot on medications, but managing arthritis isn't just about pills and injections, right?
You're absolutely right. We touched on physical therapy and occupational therapy earlier, but let's dive a little deeper.
Perfect. So let's start with physical therapy. How does that help people with arthritis?
Physical therapy is all about maintaining that joint mobility, making those muscles stronger, and improving overall physical function.
So keeping those joints moving and those muscles strong. What kinds of exercises are we talking about here?
It really depends on the type of arthritis and the individual's needs, but you might see exercises focused on range of motion, stretching, strengthening, and low-impact aerobic activity.
Okay, and occupational therapy, how is that different?
Occupational therapy takes a more functional approach, focusing on helping people adapt to their limitations and figure out ways to do those everyday activities with less pain.
So it's about finding practical solutions for those everyday challenges.
Exactly. Occupational therapists might teach patients techniques for things like dressing, bathing, cooking, or using assistive devices to make those tasks easier. They might also recommend changes to the home or work environment to reduce strain on the joints.
So it's really taking into account the person's entire life and helping them find ways to improve their overall quality of life.
You got it. And both physical and occupational therapy can be incredibly empowering, helping people maintain their independence and live fuller lives.
And that's what it's all about, helping people live well, even with arthritis.
Couldn't have said it better myself. Now, I know we've covered a ton of information today, but before we move on to the last part of our deep dive, I want to stress one really important point.
Okay, what is it?
Managing arthritis is a team effort. It takes a partnership between the patient, their healthcare provider, and often a whole team of specialists.
So it's not just about seeing a doctor and taking some meds.
Definitely not. It's about open communication, making decisions together, and working as a team to find what works best for that individual.
And that includes bringing in other healthcare pros like physical therapists, occupational therapists, and maybe even a rheumatologist, depending on the situation.
Exactly. And don't forget about the support system outside of the healthcare team, too.
You mean like family, friends, support groups?
Yep. Having a strong support system can make a world of difference for someone with arthritis. It provides that emotional support, encouragement, and even practical help with those day-to-day tasks.
So it's about taking that holistic approach again, considering the physical, emotional, and social aspects of living with arthritis.
Well said. Now, let's take a little break here. We've covered a lot of ground in this part, but there's more to come. In part 3, we'll dive into some of the cutting-edge research and emerging treatment options, and we'll leave you with some final takeaways to help you on your journey as future healthcare professionals.
And we're back for the final part of our arthritis deep dive,
Hmm.
ready to go beyond the basics.
You bet. We're going to explore some of the latest research and those up-and-coming treatments that are really shaping the future of arthritis care.
All right, hit me with those cutting-edge insights. What's got you excited in the world of arthritis research these days?
Well, one area that I find super fascinating is the role of the microbiome in arthritis.
The microbiome. You mean all those bacteria and microorganisms living in our gut?
Exactly. And research is starting to suggest that the makeup of our gut microbiome can actually affect inflammation throughout the body, and that includes inflammation in the joints.
So are you saying that an imbalance in our gut bacteria could actually contribute to arthritis?
That's what scientists are looking into. And if it turns out to be true, that opens up a whole new world for prevention and treatment.
Wow, that's incredible. So could we potentially modify the gut microbiome to, like, reduce inflammation and maybe even prevent or treat arthritis?
That's the hope. It's a really exciting field of research, and I think we'll see some major breakthroughs in the next few years.
I can't wait to see what they come up with. So what other innovations are on the horizon for arthritis treatment?
Stem cell therapy is showing some real promise.
Stem cells, those are the cells that can turn into all sorts of different cells in the body, right?
That's right. And researchers are trying to figure out how to use those stem cells to repair damaged cartilage in arthritic joints.
So it's like giving the joints a little regenerative boost.
Exactly. The idea is to use them to either get new cartilage growing or to replace the cartilage that's already been damaged.
It sounds almost too good to be true. Are there any clinical trials happening for stem cell therapy and arthritis?
There are. And the early results are looking pretty good. But we're still in the early phases, and it'll probably be a few years before stem cell therapy becomes a, mainstream treatment option.
Got it. So definitely something to keep an eye on. Any other promising treatments in the pipeline?
Personalized medicine is another area that's really interesting.
Personalized medicine. That's all about tailoring treatment to each individual patient.
Exactly. The goal is to use things like genetic testing and other biomarkers to figure out the absolute best treatment for each person. That way we can get the best results with the fewest side effects.
So it's like creating a customized treatment plan.
Exactly. And with all the advancements in genetic testing and data analysis, personalized medicine could really change the way we approach arthritis treatment.
It sounds like the future of arthritis care is all about getting more targeted and individualized.
That's a great way to put it. And that's what makes this field so fascinating. It's constantly evolving.
Well, we've covered a lot of ground in this deep dive, from the different types of arthritis and their symptoms to risk factors, diagnosis, and even all those different treatment options.
We've explored pretty much everything, from those simple over-the-counter pain relievers to those cutting-edge therapies like biologics and stem cell research.
And we also talked about how important that holistic approach is, thinking about physical therapy, occupational therapy, lifestyle changes, and even having a good support system.
Oh, and don't forget about all that exciting research that's happening right now, like the whole microbiome connection and the potential of personalized medicine.
It really feels like we're on the cusp of some major advancements in arthritis care. It's a pretty amazing time to be learning about all of this.
I completely agree.
So as we wrap up this deep dive, what's the one key takeaway you want our listeners to walk away with?
I think the most important thing to remember is that arthritis isn't a one-size-fits-all condition. It's a complex disease with so many different causes, symptoms, and ways to treat it.
And as future healthcare professionals, we need to approach every patient as an individual. Be curious, keep learning, and always provide compassionate, personalized care.
Couldn't have said it better myself. Remember, knowledge is power. The more you know about arthritis, the better you'll be able to help your patients navigate this condition and really live their best lives.
Thanks for joining us for this arthritis deep dive. We hope you found it helpful and maybe even a little bit inspiring.
And until next time, stay curious, keep learning, and we'll catch you on the next episode of Medic Talk.